scholars on this topic who really do not need an introduction. Professor Pnina Werbner and Dr. Fazila, as I believe all of us know that, Professor Werbner is a Professor Emerita in social anthropology at Keele University in the UK, Muslim women with reference to gender and migration, then cultural hybridity, anti-racism, and so on. And similarly, Dr. Bhimji is a senior lecturer in the School of Humanities and Social Sciences at the University of Central Lancashire, UK, and she works extensively on the media representation of migrants, multiculturalism, and racial violence, to name a few. So welcome, Professor Werbner and Dr. Bhimji. There couldn't be a more suitable cohort of scholars to discuss the Indians, Pakistanis, and Bangladeshi migrants and their stories of survival in the pandemic in Great Britain right now than you do. So thank you very much for joining us today, and I'm really very grateful to have you as panelists. Before we formally begin, I would like to mention a few things regarding the session, just a couple of things. Firstly, today's session is split between a panel discussion and followed by an open house where the participants are invited to post their questions and comments to the panelists. And regarding the time split, the panel is going to be for around 45 minutes and the open house will be for around 20 minutes. And regarding discussion or like communicating with the panelists, there is a button in Zoom which you can press, like raise your hand button on Zoom, which you can press and ask your questions directly. Or if there is some miscommunication due to technological problem, then you may please write your question in the chat box and we will take them up. So also, the last thing that this panel discussion is going to be recorded, as you must have heard already. So I would request you not to take any picture or record any portion of the discussion. They all will be available in the GSSA website, open access. So if you would ever like to go back to them later. So this brings us to the end of the structural nitty-gritties of the session, and I now formally would like to start the discussion. So let's start with Professor Werbner. Professor Werbner, this pandemic and the lockdowns, then gradual so-called unlocking, and then the second phase of lockdown in UK, and now there is a new strain of the virus emerging. At the same time, there is a vaccine situation. So it has been quite a roller coaster in the UK so far. So within that context, at a very generic level, how has the COVID-19 affected the South Asian migrants in the UK as of now?
Yes, I mean, let me start from the fact that I did research among South Asian. I've done research for many years, but really at the beginning of my career, I did a lot of research on what used to be called ethnic entrepreneurship, ethnic enterprise. And one of the tragic ironies of the current situation is that it is precisely because of the achievements of South Asian migrants coming to Britain in integrating into British society through economic activity, petty entrepreneurship, that they are now one of the major groups that is suffering disproportionately from the COVID, according to statistics, COVID-19, and one sees it also on television and so on. So I just wanted to give some idea. According to the Office of National Statistics in Britain, men working in security guards, taxi drivers and chauffeurs, bus and coach drivers, chefs, sales and retail assistants, low-skilled workers in construction and processing plants, and men and women in social care, there are significantly higher rates of death from COVID-19. Now, taking that kind of list, it's known, and anybody who's traveled in a British city will know that taxi drivers are incredibly, have an incredible number of South Asians and bus drivers. The mayor of London, Sadiq Khan, and one of the doctors, both with children, sons of bus drivers. So that's one area, this area of transport in which South Asians have been disproportionately exposed to COVID-19, but also, as well as public transport, retail. Most of the small grocery stores and off-license stores in the big cities are owned by South Asians, and they have direct interaction with customers. So they too have high exposure to the public. It's the exposure to the public, often without masks, without any kind of protection, that has been one of the main reasons that South Asians have been affected. They are not much represented in the health and care workforce. That's mainly African migrants and others. But as doctors, they're a very high proportion of hospital doctors that are South Asians. 40% of doctors, 20% of nurses, and 17% of social care workers are from what are known as BAME, B-A-M-E, British, Asian, and minority ethnic groups. In London, nearly 50% of NHS. But what I think is significant here is that hospital doctors from South Asian groups are often in geriatrics. And that's one of obviously the groups that has had a very high exposure to COVID, and therefore they are themselves very exposed. I mean, there were questions about genetics. Why are South Asians so prone to dying from COVID? But it doesn't seem to be a genetic thing. It seems to be primarily a matter of occupation. But there are other issues as well. I don't know. Do you want me to go on? So one of the big issues has to do with health. And South Asian groups have high rates of diabetes, and this can be true even of doctors, high status groups. I think the reason may be that they come from a background where the food wasn't as rich, the availability in Britain of certain kinds of food has become a reason for South Asians get overweight, even obese, and that comes with diabetes. But they also have, because of the same reasons, high levels of high blood pressure, cardiovascular diseases, and all these are high risk, and obesity are high risk factors for getting COVID and dying from it. So that's one kind of issue. Second kind of issue. The third issue has to do with housing. And this has been commented on repeatedly in the press and so on, because there are many South Asians who live in crowded housing. It's all part of this strategy of social mobility that has worked very well for many South Asians, but has a price to pay in this period of COVID. So they share housing, and they have multi-generational families living in the same house. And this, of course, saves money, which allows investment in business and so on, but it's not very good for isolation in this kind of infectious disease. So that's one reason why South Asians are also prone to getting and dying from COVID. Okay, so in London, 30% of Bangladeshi households, 60% of Black African households, 80% of Pakistani households have more residents than rooms, compared to only 2% of white British households. BAME, as I call BAME, households are more likely to be intergenerational, grandparents living alongside grandchildren. health inequalities. So these kind of health inequalities increase the risk of transmission and of mortality, especially because of comorbidities, like, as I said, diabetes and obesity.
Right.
So this is one aspect. Now, another aspect which is also linked to occupation, and which I was particularly interested in because it was a feature of Manchester entrepreneurship, was the creation of the small factories in the mainly clothing industry. And there you've got people, some people work at home, which is okay, but where they work in small factories, they're usually very crowded, the conditions are not that hygienic, and you've had high levels of infection. So that a place like Leicester, which has particularly, these are not mainly Pakistanis, but more Indians, but Pakistanis as well, and has a very high South Asian population working in these small factories, has had a very high infection rate for some time. So we see all the time the way that occupation and the strategies that these immigrants have in order to save money, invest in, which has been very successful. This is the tragic irony of what's happened. They have had very successful strategies for getting out of the sort of working class, low level occupations. They are self-employed in large numbers, but this has come with close proximity to the public. They don't work in offices. They can't work from home. They're in close contact with the public all the time. And this is where they seem to be more prone to infection. Now, there is another question which has more to do with racism. Maybe I'll leave that for the moment. Let Fazila say something, and then maybe we can come back to racism.
Right, right. Yeah, I mean, from what you're talking about, say the manufacturing structures in Leicester, and I'm just tempted to now move to Dr. Bhimji. Dr. Bhimji, we know that there are certain areas in certain areas in the UK where the which is dominated by the South Asian migrant population. Now, could you tell us a little bit about what's happening in those areas in specific? What are their stories? How are they negotiating for last 1 year or so with this pandemic?
Yes, sure. The thing is, at the moment, Britain is under national lockdown, so there is no preferential treatment given to one area over the other. But for a while, from March to July, also Britain was under national lockdown. But after July, the government introduced a tier system where some areas were in stricter lockdown compared to others. So there was this system of tier 1, tier 2, and tier 3. And this is what happened, that some regions were disproportionately affected by the tier system, and it so happened that certain South Asian areas were under stricter lockdown than others. For example, in July 4th, when Britain came out of lockdown, the entire country, Leicester was one area which didn't come out of lockdown, and it remained in lockdown for a total of 150 days, and people came to understand it as a forgotten city. And there was no reviews. There were, the MPs of Leicester were really upset. The people were really angry that why is Leicester under perpetual lockdown when compared to other parts of the UK, when even the infection rate was shown to be less than compared to other cities. And Leicester is a middle income region. It's not as poor as some of the other northern towns in Britain. So it was really interesting that Leicester remained in this lockdown. So I have some quotes here of where, some statistics here, So no one ethnic group is the majority. The white British is 45%. Indian, and this would be interesting to you, is 28%, which is the largest ethnic group. And then the remainder of the population comprises a diverse mix of ethnic groups, including Asian other 4%, Africans 4%, and Pakistanis only 2%. And I don't think, and Bangladeshis. So Bangladeshis and Pakistanis are among the South Asians, which are on the lowest, socioeconomic ladder, and also perhaps more racialized than Indians. So, and Indians are among the middle class, but they still remain closed. And Health Secretary Matt Hancock imposed restrictions that not only remained in place in Leicester, but in fact they were tightened, and people were, prevented from mixing. And at some point, people didn't even know what the rules were. And there was one person who said to the media that Leicester was made out to be this disease city, and they were treated like lepers. And which, so people were really angry. And Leicester continued to have extra restrictions, and its infection rates were dropping from 135 cases per 100,000 to 88.7, which is very low. It sounds really low at the moment, right. Because it's gone really high. And the city's mayor, said, quote from the city mayor, "We have become a footnote in the Department of Health news releases." And so there was this, tier 3 restriction, which Leicester continued to experience. It was similar with Blackburn, another, area with perhaps more Pakistanis and compared to Leicester, less Indians. But here people, 66% identified themselves as white British, 28 as Asian British, and 0.6 as Black African. And people in Blackburn also had been urged to follow tougher control measures. And an anti-racist activist said the South Asian community in Blackburn had been put under a spotlight due to COVID-19, which was unfair and negative, and it was upsetting to have microscope on the town. And then the worst situation for South Asians in terms of lockdown was during Eid al-Adha. So 3 hours before Eid al-Adha, the government, through Twitter, announced that Eid was cancelled. So imagine, we made such a big deal about Christmas. The British government allowed household mixing and relaxed the rules, and as a result, I think the new variant came about. But during Eid, Eid al-Adha, the second Eid in July, there was just this notice given 3 hours, and people had made preparations to meet each other, and Eid gatherings were organized. And then like one resident said, well, pointing to a pub, that people in the pub were allowed to gather, but drinking at that time, pubs had opened in the summer, and people going out dancing. But suddenly Eid was cancelled, and so the Muslim community then started to feel like targets of the lockdown under this tier system. And then there was this report written by Seema Iqbal, a GP in Manchester, which I will read out because she said some interesting things here. That the announcement by the UK government to increase lockdown measures against Greater Manchester 3 hours before Muslim communities were beginning to celebrate in Eid al-Adha came as a total surprise, even though local restrictions had been put in place already over the past few weeks in nearby Rochdale and Oldham. So this was on top of the tier 3 restrictions. So, and perhaps she said further restrictions were needed, but Boris was beginning to feel like the Grinch who had stolen Eid. And South Asian communities then started to feel that they were being blamed for, the cause and rise of infections. And it was also pinpointed towards Muslims because Diwali wasn't banned later on in October, and it was really banning Muslims from celebrating Eid al-Adha at a time when Britain was opening. This was like really July 4th, the country opened up, and Eid al-Adha was, I think, towards the third week or end of July. Now I forget, not later than the first week of August for sure. No, actually it was the third week of, end of July. So this was a real surprise that why is it that suddenly, Eid was cancelled, and now, months later, we can reflect on that Christmas was allowed, the Diwali was allowed, but the Muslim population was targeted. So again, she said, this GP, that the government needs to do better than introducing lockdown restrictions in a manner akin to sending an email at 5 p.m. on a Friday afternoon while exiting the building. They also need to understand that the British public will not be the fall guy if the rates spike again. So I think there was this, in terms of government policy, there was a disproportionate impact on British Asians, particularly on British Muslims, which, and it did feel that somewhat racialized some of the way in which the policy was directed. I mean, right now, Britain is under national lockdown, so it's difficult. Now it's like everywhere it's equal, but under this tier system, British regions in Britain came under focus, which were dominated by South Asians.
Right. Thank you so much, Dr. Bhimji. Professor Werbner, in this case, and since you were also, talking about anti-racism, let me just come back to you. As Dr. Bhimji talked about, how the, Eid al-Adha was the only celebration which was kind of targeted, apparently, because Diwali was not banned or Christmas wasn't banned. Do you look at this, within the larger context of the anti-Islamic sentiments, or how do you think, or do you think that, there is a race factor involved, or also a very strong anti-Islamic factor involved in this entire discourse in here in this context?
It's not totally clear, but it seems that one of the speculation is that because of lack of trust and fear, South Asians have reported late to hospitals and so on. So one reason that many got very ill was because they went to hospital later than maybe white people had. But such crises do uncover the kind of fractures within communities, although they vary from country to country. So that, for example, in Italy, the attack was on African asylum seekers, and Donald Trump attacked Chinese. So one can say that racism heightens vulnerability to COVID-19 at all levels of society, not only among deprived social groups, but also among high-income professionals.
Right.
So I think that there is an underlying kind of fear and resentment that comes out during such crises. One of the things that I think also might be linked in a way to racism is the fact that as long as the south of England, which is whiter on the whole, had low rates of infection, then somehow or other it was okay to persecute, as it were, northern communities, and it was assumed that many of them had a lot of ethnic minorities and South Asians in places like Bradford or Oldham or whatever, Blackburn. So there was a divide, a north-south divide with Leicester, which ended up being also, in some ways, a divide around race. But the moment that this variant came in, and people in the south of England started to get high rates of infection, then that disappeared. Suddenly, the government was taking much more seriously the actual disease itself, not just as a kind of expression of ethnicity or race or something, but because they white people, rich people, people from, you know, affluent communities and suburbs in the south of England were being infected in high rates. And then there was a national lockdown. The whole country was affected. What do you think, Fazila? Do you think that's right?
Well, the thing is that, you know, what I was talking about is after the national lockdown between March and July, that when things opened up disproportionately because Manchester remained pretty much in lockdown. Many of the northern communities remained in this tier system, and under tier 3, this is what I was talking about. And now we're back under national lockdown. So I'm just talking about this period where there was a disproportionate lockdown, you know, after. But prior to the March lockdown, yes, I agree with you that perhaps, I mean, I don't know where it came first, to the southern regions or the northern regions. Prior to March, I think it was all over the country.
I'm talking about now, this period.
Yeah, this period. Again, it was the, you know, that the South was disproportionately affected. And then when we went into national lockdown, until then, yes, you know, we were under a tier system with the northern communities being disproportionately under tier 3. I mean, there was a big clash between the mayor of Manchester and you know, and Boris Johnson for days and days, because the mayor of Manchester was asking that why are we under tier 3 when our rates are going down, when the infection rate is lower than that of London. And Manchester was in this perpetual tier 3 with businesses closed and the economy being affected. And the people, like Pnina Werbner said, that the frontline people, the people in these small businesses, and even one thing to add to that is the delivery people, because one of the businesses that grew was, you know, Deliveroo, and like in Germany, you have Volt.
Right.
Right.
Go on.
And who was involved in that are basically, you know, the diaspora, who were, you know, doing this kind of frontline work and delivering people, you know, the white middle class, books and food and, you know, all kinds of home entertainment and packages, and sometimes with masks, sometimes without masks. I mean, I could see from my window that people would like get their packages and then take it from the hands of the delivery people. They would open the front doors without masks. And because at that time, between March and July, the masks wasn't so much enforced. So yes, I think after, and then came the national lockdown, the recent national lockdown. It was only, like Pnina Werbner said, that the South got, you know, it became apparent that the new variant was emerging in the South, and then we went into national lockdown.
Another thing is certain other signs, sort of consequences of discrimination, like prison populations. There's a very high proportion of Pakistanis in prison, relatively speaking, and these populations were very susceptible to being infected. And one could look at different ethnic groups in Britain and see what kind of occupations they had. So, for example, the care system, where carers were disproportionately affected. Well, those are mainly Africans and Filipinos and nurses also. And so you get these kind of occupational groups that are being hit very hard by COVID, and which are also vulnerable because, for example, in the early days, they didn't dare to demand PPE, as it was called. So they were less protected than white people because they were less willing to stand out and demand their rights. And even today, you've got these carers moving from nursing home to nursing home and being exposed to the virus and not being vaccinated. So now there's a big question about the vaccination, getting everybody vaccinated who's a carer or a nurse or a health worker. And this is only now they begin to say, now we will do it. So really there have been all kinds of choices made which affect different ethnic groups. The South Asians are much more in, as you said, retail, transport, things like that, maybe messenger. I don't know about messenger services, but in any case, they're in close contact with the public all the time. I'm not sure how careful they are. I don't know what you think, Fazila. Our local grocery off-license store, he never wears a mask. I've only been there once or twice, but he seems not to wear one. I don't know why. But I think on the whole, people try to be careful, but when you're living in a big family, then
I mean, once I went to local.
What's that? So I think that there are these.
I mean,
Yeah.
I went regularly during.
Yeah, I mean, yes, please. Please continue.
Fazila.
Yeah, so I went regularly actually between the lockdown from the period of March and July, every week to my local Asian store, because, you know, I felt like the supermarkets were so crowded, and at that time COVID was so new and nobody was wearing a mask in those supermarkets either, and they were far more crowded and all the goods were running out, and I felt like I could do without pasta for sure. And so I was like really you know, cooking Asian food for those 3 months. So it was mixed. Sometimes they would wear a mask and sometimes not. And I think also it was the fault of the government, because between that period, there was no enforcement of masks. There was no, you know, message coming out of the from the government that masks were needed. I mean, some of the clients or the customers were wearing masks and others not. But it still also felt safer to go there because there were fewer people, you know, even though it was a smaller store and people had to queue up to go to the stores. And then a lot of their vegetables and fruits and everything was outside. I mean, also at that time, it wasn't very clear that the virus actually doesn't, it's safer to be outside rather than inside. So one good thing about those stores was that their fruits and vegetables were out in the open, and that you could select and just go inside to pay, and whatever you needed from the inside, you could just pick it up quickly. So in some ways, to me, it felt like safer being there. And those people, the grocers, I mean, they're doing well. I mean, also, they haven't been affected. But I think people who have been perhaps in other lines, taxi workers died, bus drivers in London were among the first people to die. It's sealed off, you know, where the bus driver sits. That should have been sealed off. So I think there was a lot of like disproportionate impact because of government policies, the fact that there are frontline workers, South Asians, and to some extent, yes, health issues, but then people eat cheap food when, you know, if you're on a lower income, then the fact that, you know, they couldn't say, they had to survive one way or the other, and they were more likely to be in certain kinds of services, and therefore they were, as Gary Young said, more likely to suffer from COVID because of simply being in the front line in all kinds of services. I mean, with the taxi drivers, like the passengers, how many passengers were wearing masks in the beginning when you had these disproportionate, you know, deaths? it's also it's a two-way thing. So many of the times when I took the taxi, because at that time I was really scared to even go on the bus, you know, because I would go for a walk and then, you know, return by taxi sometimes. You know, the taxi drivers would wear the mask, but then I would see other passengers not wearing a mask. So I think being in the front line, to me, that was like one of the major factors. And why are they working in these front line? Why aren't they in offices? Why aren't they, you know, the South Asians have been in the UK for a long time, since the 60s. So by the second and third generation, they should be in, you know, southern.
Some of them are.
Hmm?
Some of them are, but this is a path of social mobility which until now has worked well for them. Going into small businesses, being independent, you know, taxi drivers or whatever.
But one question, why is it that they prefer to be autonomous? You know, why is it? I mean, the other thing to compare is that, okay, South Asians in South Asia, I mean, even in India, though there was a very high infection rate, people didn't die as much. In Pakistan, also the death rates have been very low. You can say, okay, the testing system is faulty, but you can't hide death rates or overflowing hospitals. So why is it in South Asia has been just, you know, disproportionately affected in a positive way, that there have been less people who have died in the subcontinent compared to the South Asian diaspora?
Well, one of the explanations is, of course, the diet. They have a very rich diet and lots of diabetes and stuff like that. They have a lot of comorbidities.
But is it also not about the structural crisis that we are trying to locate? Like, you know, as Dr. Bhimji said, that, you know, why these so many South Asians, despite you know, being in the UK for since 1960s, so many of them are employed in the low skill jobs and the you know, like the frontline workers. So that there has to be a structural explanation for that.
They like those kind of jobs because, as Fazila said, they want to be independent. Those jobs give them independence. And some of them get very, very wealthy. There are occasions of very wealthy Asians who come out of the grocery trade or the textile or the clothing trade or transportation. So it is a path towards great wealth. And of course, not all of them, some of their children become lawyers and doctors, but they have many.
Right. I mean, yeah, of course. I mean, there are different kinds. I mean, of course, the South Asian diaspora is not a monolithic group of people, of course. But at the moment, I would just like to take our conversation to another perspective and bring the, you know, the question of media representation. Like, you know, a lot of what we understand to be how the South Asians or how the Africans, how different communities behave is also informed by the way the media projects, you know, their behavior or the perceived understanding of these communities. So, Dr. Bhimji, my question to you in particular in this case is like, how do you locate the media representation of the South Asians in this pandemic so far?
So between March and July, I was really following the media very, very closely. And I think Channel 4 did a very nice job about going into communities and talking to people and talking to, you know, also relatives and families of the doctors who had died, because the first 8 doctors who died were from BAME background. Now I forget, you know, to what extent it included South Asians, because suddenly there were also Middle Eastern doctors who had died. And Channel 4, you know, talked to a lot of, they raised the question over and over again as to why, you know, the BAME communities were disproportionately affected, and they gave a lot of attention. But like then there was other media, because the media, of course, in the UK is not monolithic, you know, blamed the South Asians themselves for contracting COVID, because some of it was this whole debate about vitamin D. And vitamin D deficiency among darker skinned people, it hasn't been proved whether we are deficient in vitamin D or not, but it has been shown that there is a causal link between being given high dosages of vitamin D and prevention of COVID. So the media, I think, was focusing on these inherent causes. They focused a lot on these multi-generational households. And then there was somebody from Leicester who spoke up that even though we live in these multi-generational households and extended families, which is also part of the culture and not necessarily, always economic reasons. And like Pnina Werbner said, that in some cases, South Asians are, from affluent, have become affluent, and then they live in these, gigantic houses with 2 wings and so forth. So they are separated. I mean, even in South Asia, people continue to live in within extended families or multi-generational households, but they aren't, they're being careful that about the way they spend time with each other, or they wear a mask, or they meet outside in the garden. So it's not, you can't just pinpoint to that fact, because obviously, the media has put out the message of social distancing and wearing masks and so forth. So the idea that just being in a multi-generation household would cause COVID cannot be the only factor responsible for COVID. So the media just continued to focus on that. And then another interesting specific example was how the media said early on that all of this COVID infection was coming from Pakistan. So the Telegraph, the Sun, many of the news outlets reported that actually 50% of the cases that was happening in the UK was imported and originated from Pakistan. And to this day, Pakistan has reported fewer cases, and there has been not this media attention given in the BBC. There's been some comment that why did Pakistan succeed? Because they had this team of polio workers, and they had a very efficient system of test and trace, which the British failed. And what Britain did is they imposed like a quarantine system that if you came back from Pakistan, you had to quarantine, or you couldn't come, or they imposed further borders. While right now, Pakistan has also, imposed, unless you have a NICOP or a Pakistani passport, you can't go to, as British citizens cannot go to Pakistan at the moment. But at that time in March, 20,000 people were flying in from Spain every day, and only 65,000 people had traveled from Pakistan since March, and mostly on British passports. Yet the stories were leading with the figure of 65,000 people, insinuating an influx of disease thanks to Pakistan. So the headline said, deadly spread. Half of UK imported coronavirus cases originate from Pakistan. And there was, amid this call for tougher checks on high-risk countries. A high-risk country at that time was Italy, not Pakistan. But the media, the Sun and the Telegraph, and the the tabloids focused on the Daily Mail, for example, insinuated that half of the COVID-19 cases were coming from Pakistan. And then, the vitamin D deficiency story was focused on, and then the multi-generational households. And one person from Leicester said this was actually disrespectful assumption and a lack of understanding of how people live. And he said that, that even though he lives with 6 other family members who are key workers, family stuck to social distancing rules. And even when people contracted COVID-19, the family isolated to ensure that no one else was affected. I mean, even in, like, if you think about in Berlin or parts of Germany, you have this WG system where students, or young people live together. But there are rules for that if somebody were to contract, then they stay in the room, and then people would organize food for them. Or, I mean, this is also was the same true among Latinos in Los Angeles. Now I have a lot of friends who are contracting COVID because in LA the system is really, really bad with 1 in 5. But the rule is that if one person were to contract that, they would not be in front of their parents without a mask, that they would stay in their room. And if they had a very young child, like an infant or something, then they would, the mother would probably go into quarantine with that child because the child would refuse to be left alone. And children are less likely to, suffer from COVID in the same way as adults would. So there are these also rules set up within the multi-generational household that they weren't like living totally of rule. So the media kind of zeroed in on this, and also on the other hand, like Channel 4 kept urging that the government, try to find out the reason and to try to see what kind of structures are affecting this disproportionate impact of COVID, which to this day is not clear because these reports were never made very transparent. And then some people in the government said, okay, it's due to structural racism, and others kept quiet. And so it's still remains ambiguous, I think. But the media, at least the mainstream media, kept trying to find out like cultural and factors, or even some inherent, health deficiencies,
Right.
For the cause.
Right. Right. Thank you so much. This is really interesting. And of course, I mean, it will only unfold, especially when the vaccination phase now that it has started. So my next question, and it is the last question, formal last question in the panel, and we can of course continue the conversation in the open house. And it's a common question to you both. So in the light of what we are talking about, like the stereotype of the South Asian migrants as the media portrayal happening, and the systematic racism and the structural crisis, or that puts these people in a disadvantageous position perhaps, and makes them more vulnerable. I'm just wondering that how do you think that the vaccine phase is going to be? I mean, we heard that there are a lot of there are certain discriminations, there are certain disadvantages, and there are certain real issues which are kind of as an obstacle to handling COVID within the South Asian diaspora in the UK. And but within that context, is the UK government going to be racially selective, or in terms of choosing the BAME people for vaccination? And how is this entire situation going to unfold as the vaccine rolls out? Professor Werbner, would you like to go first with this?
Yes, I don't think there's been discrimination, in fact. I think that it's just been slow, I mean, very slow. So they have categories over 80 and so on. And then the question of vaccinating health workers, which has come up now as a big issue, that the next tranche will have to be health workers because they're not coming to work. Many of them, they're ill or they're in quarantine. So no, I don't think there's been discrimination in that way. And I have to say that the newspapers I read and the TV news I watch hasn't blamed South Asians, but so I'm interested in hearing what Fazila had to say, because I hadn't seen that. I hadn't seen that side to the British press. But I think that the trouble with the vaccination program is more the government's inefficiency and also their decision making. So, for example, now they want to say that people will get the second Pfizer vaccine more than 3 weeks after the first one, which is really against the instructions of the manufacturers. And there's no evidence that it works. If you get the second vaccine 6 weeks after the first one, it may not work. So there are all kinds of inefficiencies within the health system in Britain, and well, the people running it, that one could complain about, but not specifically to do with the BAM community. I mean, the hospitals are still run with Indian and Pakistani doctors and other immigrant doctors. It's an amazing thing, actually. And they've been very, very self-sacrificing. So I think that there's sort of, it's not all bad. Many of the associations of doctors I noticed were headed by Indian and Pakistani doctors. Don't know if you noticed that, Fazila. So, I mean, and quite a few of the professors and experts are South Asians as well from the universities. So, I mean, they're obviously been pulling their weight enormously. But it's just, I think the British government itself has been inefficient. I don't know what you think, Fazila.
Well, yes, I would totally agree that the British government has been inefficient in every aspect, and that's why one of the reasons I think I left, because, you know, I'm by myself in Britain and I was a bit scared. Okay, but that's another story. But the thing is that if you think about, like you pointed out, that what Britain has done with the vaccination system has introduced 8-category system. So the first is like by the age, and then somewhere down the line, it's carers and doctors and frontline hospital workers. I forget, it's the 3rd or 4th category. So now you have to think about who, like you mentioned, and like we know, that who are the doctors, who are the carers, who are the nurses, who is in the NHS in Britain. It's mainly migrants, whether it's Afro-Caribbeans, whether it's African nurses, whether it's South Asian doctors. They are the ones who are basically form part of a very important aspect of NHS. I mean, like Gary Young said, when we were clapping every Thursday, he's a black Afro-Caribbean sociologist now at Manchester University, and he writes for the Guardian column. And he said when we were clapping for the NHS, he said that they were basically clapping for me, for us, not him personally or not for me personally, but they were clapping for the people in the NHS, which comprised mainly of migrant workers. So why, I mean, this is a big debate, that why are the frontline workers, the carers, have not been up higher in the list? Maybe the 90s and above could have been vaccinated first, but at least they should have been put in the second, or they should have been vaccinated alongside and should have been prioritized. So in some ways, okay, it's not being made very obvious that the carers and the nurses and the doctors and the frontline workers who have been responsible in caring for the COVID patients and have been extremely committed and have died, many of them have been died, and that you know, that they wouldn't be vaccinated. What was the point of clapping every Thursday for week on and week on when you can't even, you know, put them as number 3 or number 4 on the list on this category? So yes, and then the other issue is, you know, the inefficiency of the UK government as a whole. It's like, you know, quite despicable that, you know, first we're being promised that they would be given 3 weeks apart, and then giving the 12 weeks. You know, now changing the policy that the first dose is going to be given, you know, and then the second dose you will be given 12 weeks later instead of 3 weeks. At least the people in the front line should be given their vaccine dosage 3 weeks apart. I mean, my friend who's a doctor, is a South Asian doctor in California. Not only she, but her husband have already been given the Moderna dosage. So I was like quite surprised, and I was like, well, in Britain, you know, we're just the doctors and nurses and so forth, the frontline are waiting. So I think there is this link between the fact that the carers and ethnicity and race, that they are having to wait, whereas the Queen and husband.
Right.
The Queen is 95, Fazila. I mean, she's in the top category.
Yeah, but Okay, maybe after the Queen, it would have been their turn.
I think they are trying to get it.
I mean, the thing is, there would be nobody to take care of the 95-year-olds if everybody, all the carers.
I think that's why now they will be giving the frontline health workers.
Yeah, I hope so. I hope so.
Prioritizing them as well. But yeah, I mean, one can complain about the delivery. It seems to be very slow, and the other issues as well. I think it's not as bad as it sounds in some ways. It's not racist. It's just inefficiency half the time.
I think there's inefficiency, and to some extent there are these underlying systemic racism, you know, which is not like, you know, post-COVID. It's been there. I mean, especially again, this Islamophobia, and I mean, the fact that Eid wasn't allowed, there were, you know, all these illusions made that the, you know, disease was coming from imported from Pakistan.
Yeah, I didn't hear that, but that's really.
Is that Pakistan hasn't been even given credit. I mean, this should be in the frontline news that there are some countries, you know, that are actually doing in the global South are doing better than Western Europe and particularly the UK. And this hasn't been given sufficient news because we are so used to hearing, you know, children dying and seeing particular images of the global South that we're not hearing any of the good news stories. Because what Pakistan did, like that, they had this team of polio workers that went from door to door testing, and they had a very strict, you know, what they called a smart lockdown, which was basically a tier system, which Pakistan introduced very early on, and it kind of worked, and it kept the infection rate down. But, you know, I mean, I only came to know about it by reading the local newspapers, and some of these stories which have escaped British media is also a sort of a bias towards the media, that they only report when, you know, they reported so much on Ebola, but now there's been some success in the global South that's been absent in the media. Anyway, those are my views, obviously.
Right. Yeah, I mean, of course, I mean, I think you pretty much highlight the structural crisis and the, you know, the systemic racism, which also provokes us to question, like, you know, why it happens as it happens. So it is not just a description of what is happening. We also have to really look into why it's happening for a reason, and which predates COVID. I mean, COVID is just adds to the perspective. But, you know, these structural problems are not specific to COVID. It emerged before COVID, and COVID has, you know, nuanced and has helped this structural crisis to manifest. Thank you so much. This is a really a thought-provoking discussion. I mean, I'm having to stop formally for the time management purposes, and then we definitely take this forward in the open house. Before we just open the house for further discussion, I just have one or two thoughts to share, which emerged from the very enriching discussion that we had with Professor Werbner and Dr. Bhimji. So I mean, the first thing that comes to my mind is, like, maybe it is pertinent to compare the situation of the South Asians in Britain at some level with the African Americans in the USA, or the Latino migrants that, you know, we were talking about a little earlier. The session began. So the stigma, the invalidation, all these are very similar. The poor condition of living, the work situation, unemployment due to pandemic, which has left the African American community quite vulnerable in the US right now. And together with, we have the white supremacy, which is also very much institutionalized in the USA at the moment. And we all know what happens in 6 January. So all they are very much tied together. And this kind of, these kinds of shadow pandemic, as we call it, based on racism and sexism, they open up a whole new terrain of negotiation within the larger question of COVID. Another context here, especially regarding the BAME people, is that, as I was just saying, that, within their own identification as minorities, which is also, they are also a very diverse community, like, in terms of religion, status, gender. So the South Asian diaspora is not monolithic. So just, in terms of discrimination within the diaspora, like, not just between the host society and the diaspora. For example, the Indians and the Pakistanis back in their home countries, they have unfavorable sentiments towards each other, mostly the governments, but, also at some level, the people, the Indian people and the Pakistani people, they have some, like political, issues against each other. But one is left wondering, do they do the same in the diaspora? And does that have any repercussion in terms of the pandemic? Next, during my very limited field work in London in 2017, I came across a lot of Bengalis from India, and they were like, high-end doctors and, high-end professionals, Bengalis from India. But they said that, they maintain very, like they maintain distance from the social, not the social distance in the COVID sense, but, social distance in terms of interaction and, making friends with the Bengalis from Bangladesh. Now, because of a massive, status differentiation between the two. And I was also wondering if it's about religion, because the majority of the Bengalis from India are Hindus, and those from Bangladesh are Islamic. So this is also something, it is a kind of interesting to note. So one is left to wonder that whether this discriminations about the, during the pandemic is also happening within the diaspora, and just not, between the diaspora and the host society. And lastly, although it is difficult to answer substantially without enough research, but I think it is also important to engage with the question of what kind of future of immigrants is going to be in the UK, especially within the larger context of anti-Islam, which is like an overarching sentiment all over the world, and also the structural crisis that we have been talking about. So how all these, or will all these at all inform UK's future of receiving immigrants from the South Asian countries in a post-COVID situation? So with these thoughts and with these questions, I would like to now formally open the house for further discussion. And of